Hello, my name is Cheryl Kraus. Welcome to GHS 950 Evidence-Based Professional Portfolio 3. My advisory panel includes Dr. Federico, Dr. Meyer, and Dr. Linval. I am a Doctor of Health Science and Exercise Leadership candidate at California University of Pennsylvania, Department of Exercise Science and Sports Studies. Beyond Mindfulness, a gap year for burnout prevention. The aim of stress reduction interventions must match individual needs. While mindfulness-based interventions may be an appropriate degree of intervention, some students may require a deeper level of well-being triage. The option of gap time provides students the necessary space to reflect and reevaluate. This helps them alleviate stress-related symptoms before they have to return to the intensity of their academic program. According to Rashad and Kibble and the Association of American Medical Colleges, more than 65% of matriculated medical students take time off between their undergraduate studies and medical school due to stress-related problems. Gap time provides students with the opportunity to temporarily remove educational obligations and associated stressors, helping them relax, refocus, and reboot in the direction of their life's calling. Gap time exists in many forms, such as internships, travel, paid work opportunities, volunteering, and exploring outside their program of study. The peer-reviewed journal selected for this assignment is the Journal of Wellness. I chose this journal because it features an open admission, is a peer-reviewed index journal that publishes original research and reviews articles across various medical, physical, and psychological wellness topics. Continued research on stress reduction modalities is crucial because anxiety, depression, and suicidal ideation rates continue to climb across college campuses worldwide. This is despite previously well-intended preventative efforts utilizing traditional mindfulness-based modalities for effective interventions. The use of gap time interventions specifically allows students to experience greater clarity, reduced mental load, and also helps them align their priorities with future aspirations and goals in their program of study. A study by Guane et al. In 2020 indicated that students who take a gap time exhibit less burnout than those who do not. This is with a dose-response effect observed between the number of gap years and medical student burnout. The submission process was simple, and I followed the journal guidelines and upload processes. First, prepare submission using journal guidelines. 2, create a login for journal submission. 3, upload abstract. 4, upload cover letter and manuscript. 5, review submission. And 6, approve submission. This is the cover letter that accompanied my manuscript to the Journal of Wellness on May 16, 2022. I believe it fits the wellness criteria to enhance overall resiliency of physical, emotional, and psychological well-being of healthcare professionals and personnel in the field. This slide highlights the manuscript guidelines and submission processes. The journal accepts 5 distinct types of submissions: original research, reviews, editorials, humanities, and case reports. While this looks lengthy, it was very easy to follow, and the submission process took roughly 30 minutes. There were minimal changes needed for this manuscript to be ready for submission, which consisted mainly of converting the paper from APA to Vancouver formatting. The journal's goal is to disseminate information, making it accessible to all in the healthcare and health provider field. I submitted my manuscript to the Journal of Wellness on May 16, 2022. I anticipate that it will take several weeks, if not months, to hear back from the journal regarding a decision on my manuscript submission. Surprise! I was super excited to receive an email response from the Journal of Wellness on May 27, 2022, regarding my submission on Beyond Mindfulness, Gap Year as a Burnout Prevention Model. I will be doing my edits and sending them back in for review soon. The Journal of Wellness editors expressed that my article shows considerable promise. The editor's summary included insight that would help groom the paper to fit it into the needs of the journal. I'm very excited for this opportunity. I will be editing and resubmitting soon and hope the manuscript will be cleared for publication at that time. A study by the Gap Year Research Consortium at Colorado College reported that on average, most Gap Year students demonstrate higher levels of academic performance and momentum for 3 consecutive years after returning to their studies compared to those who do not take gap time. With mounting research reinforcing gap time experience, educational career counselors could look at the discussion of academic pursuits and student well-being, focusing on merging career preparedness and optimal student health. The references used for this presentation include the Association of American Medical Colleges, Dea and Hearn, Gap Year Research Consortium at Colorado College, Goyne et al., Rabi and Naidu, and Rashid and Kibble. Thank you for your time and attention. My hope is to contribute to existing literature highlighting gap time as a positive intervention that helps students more effectively handle stressful circumstances as they arise with greater confidence and enhanced resiliency.